Dr. Kofi, tell me about yourself and why did you go into medicine? What brought you into the medical field?
Yeah, the medical field interested me for a long time. Both of my parents were nurses in their home countries, which is Ghana. They didn't really have much access to healthcare and really education. Putting those two things together as they raised me really pushed us towards the healthcare field in general. Really helps people stay active, healthy, independent lives, which is very gratifying both for myself and for our patients. So that kind of brought me to the field, and the more I've gotten into it, the more I'm glad I made that decision.
Describe me your medical schooling and what was something that stuck with you about your program.
I had the great benefit of training in multiple different cities, across multiple different practice settings throughout my training. I trained in rural areas, I trained in more city-like areas, people who spoke English, people who spoke Spanish, people who spoke various other languages, people who lived nearby, people who lived from far in the private setting as well as the public setting. So I was exposed to a lot of different ways, one, to practice medicine, two, to see how people live their lives, and three, to learn how to relate to a bunch of different people. So that really helped bring that to my attention when taking care of patients. It makes it easier for me to really meet patients where they are, figure out kind of what their walk of life is, and I can bring my experience into the patient journey.
What is your profession?
So I'm an orthopedic surgeon, which means that we are doctors who take care of the musculoskeletal system. So muscles, joints, bones, and tendons. And particularly as an orthopedic surgeon, we focus more on structural issues. So things that have done when those structures have been damaged. So broken bones, joints, arthritis. In particular, I'm an upper extremity surgeon, means I focus more on the upper extremity, though we do take care of the lower extremity and other issues as well.
What is a PA, NP, MD, and DO?
So a PA, or a physician assistant or physician associate, as well as an NP, a nurse practitioner, work closely with physicians to take care of a lot of different types of problems that patients may have. Physicians would be defined as an MD, medical doctor, or a DO, a doctor of osteopathy. Essentially, we all work together and have all roles on the team to help improve the care delivery to patients. The captains of the ship, so to speak, would be the physicians, so MD or DO.
What does a fellowship mean to you?
So fellowship is a dedicated period of time to get subspecialty training on top of your basic training. What does that mean? So residency is really basic training in a specialty. There are residencies in orthopedic surgery, there are residencies in pathology, residencies in pediatrics. On top of that, if you want to subspecialize even further, you would do a fellowship. In orthopedics, that means joint replacement, spine. Mine would be shoulder and elbow.
What specialized training do you have or want the public to know?
So I did advanced fellowship training in shoulder and elbow surgery. What that means is that I like taking care of more complex shoulder and elbow problems. So while most orthopedic surgeons, and really all, should be able to deal with basic problems of the upper extremity, including the shoulder and the elbow, when things go wrong or when things are a little bit more complicated, you really want to get to someone who's taken time and dedicated some extra time to taking care of those more complex problems in a region.
Where do you practice? What location do you practice at?
So I work with AVORS Medical Group here in the Antelope Valley and Santa Clarita Valleys. Much like my training, the good thing about this practice is that there's a lot of different people from a lot of different places who come into our doors. So it allows us to really cross paths with people and meet people where they are, whether they're coming from a place of where they're well taken care of or a place where they've had something that's neglected, English, Spanish, many other languages. We're able to take care of a lot of different people across a large geographic footprint.
What do you bring into this medical group?
And so AVORS Medical Group is unique in that it has several different ways to bring value to patients. Have you noticed it's AVORS Medical Group? It isn't just AVORS Orthopedics. We have other subspecialists who all work together. I've had the great benefit of working with similar specialists that work tangentially with orthopedics, and to bring that experience to a practice setting where we lean into those things is very beneficial. Of course, I'm also an upper extremity specialist, which is great. Can bring more specialized training to the Antelope Valley.
What services do you offer?
So we bring the full spectrum of musculoskeletal care for patients, and I'm certainly in that same realm. We do non-surgical treatments as well as operative treatments and everything in between. That includes injections, stem cell therapy, PRP. What we do is try to make sure at the end of the day the patient feels better. What that means to them is sometimes not what it means to us, but we always want to meet somewhere where the patient can leave the room feeling that, one, their problems were understood, two, their questions were answered, and three, there is a plan towards getting them to feel better. At times, that means I'm bringing a surgical option. At times, it does not. But really what I try to do is specialize on feeling what the patient is wanting to get out of that appointment and trying to meet that need.
Do you specialize in anything?
So I pursued advanced training in shoulder and elbow surgery. So I like beat up shoulders and elbows. I also take care of a lot of orthopedic trauma, which is another special passion of mine. So I like to say broken bones and beat up arms.
How long are your appointments? What might make you late?
So we try to take as long as is necessary to make sure the patient's needs are met and they have a plan towards feeling better again. And that may mean a bunch of different things. Sometimes it's a very brief appointment. Oftentimes it goes over. I will say usually about 15 to 30 minutes are the appointments. And if we are running late, it's because we're taking that time to meet patients' needs a little bit more than other people would. We have robust communication platforms after the visit, which really helps to kind of close the loop on anything that may not be covered in the visit. It just goes to the point that, hey, this is a relationship. Even after the visit ends, the encounter really hasn't stopped.
Tell us an interesting thing about your profession.
I think one of the hidden gems about orthopedic surgery is how intuitive it is, or I should say, how easy it is to relate to patients about what is going on with them. You say broken bone, and most people know what that means. You say torn tendon, people just they say, hey, yeah, I get it. I've heard of that before. It's not like trying to explain, let's say, a stroke or pneumonia to a patient. It's very tangible and at times obvious to a patient. That means you can kind of get through a lot of the jargon, a lot of the big words, and get down to the bare essential elements, what the patient needs in that moment. And there are not many fields like that. So we can relate to patients a lot more easily than most specialties can for that reason.
Why should one trust you in their care?
Well, during my encounters, I try to be 1, thoughtful, 2, transparent, and 3, act in their best interest. As I mentioned before, I think the goal is to try to make the patient feel better, or at least provide an avenue towards doing so. I think that's unique, and it's something that we do here at our practice to try to do. And I would certainly trust a physician like that.
How do you show patients you care for them and that they are not just another patient?
We always try to find one thing to which we can relate with the patient. I've had the great benefit of living in the country, I've lived in the city, I've lived in densely Hispanic areas, I've lived in areas that are the exact opposite. And the good thing is, again, you can usually find one thing to relate to a patient, whether it's the clothes they have on, the family member that's with them, or if their hair looks like mine. All these things are ways you can connect with people, really show them that, hey, you're a special person, and we're going to take this seriously and really focus on your problem at the time.
Do you have a funny story to share about your career?
I do. Years ago, back in undergrad, I'd come home to visit my parents for a break, and I was interested in orthopedic surgery, so my dad allowed me to shadow his local orthopedic surgeon. Years later, I finished training, got through residency, fellowship, all these things. I moved back home to be closer to my family, and we're looking for jobs. And I learned that orthopedic surgeon I had shadowed had now retired. And so I was just taking time, just going ahead and seeing the sights, the sounds, looking at different job opportunities. And along the way, I encountered this nice young lady. I asked to take on a date, and years later we were married. Imagine my surprise the first time she took me home, and that orthopedic surgeon I had shadowed turned out to be her father. That orthopedic surgeon I now call my father-in-law. It goes to show this world is a lot smaller than we think.
How would a patient describe your care?
I would say calm and reassuring. In orthopedic surgery, we're not dealing with brain tumors, we're not dealing with heart attacks. And so ultimately, though some issues are severe, if you can't lift your arm because your shoulder is essentially stiffened up to the point of it not being able to move, this is a problem. But at the end of the day, we can reassure them. I always like to say my family's from Ghana. In Ghana, oftentimes they don't have access to the treatments we do, yet people are coping and getting through. So the point of the visit is to help them feel better, oftentimes to figure out a calm and reassuring way to get them there.
What do you want the public and your patients to know about you as we wrap up?
I think the main point is, 1, for patients to feel better, 2, for them to live active and independent lives. I think fitness and really exercise of all varieties has the best return on investment that you could ever hope for. And that exercise doesn't have to be getting up and running a marathon every day. Sometimes just standing up when you're watching commercials, when you're watching TV, or getting up and doing all your phone calls, walking back and forth in your hallway. Any way you can stay a little more active, a little more independent, pays dividends down the line.
What do you do for fun?
So my wife and I love exploring Los Angeles anytime we can. She's a pediatrician herself, so the times aren't always there. But thankfully, we have a lot to do right outside our doorstep. So we try to explore. And we found that active date nights are usually the best. So if we're doing rock climbing, or we're doing some type of clay or pottery or something, just try to find something fun and active to do in Los Angeles.